name is Victoria Swindle, and I'm here to do my informational speech. And this is my 6 people. 1, 2, 3, 4, 5, 6. So my grandma had this terrible disease called breast cancer. Even though she had breast cancer, she was fighting every day to get through it. When she hit chemo, she lost a lot. She got drained out much quicker than she normally does. And so she was still trying to fight through it by making memories with her daughter. This is why breast cancer is so important to me. So what y'all are going to learn today is treatments and therapies of breast cancer, childbearing and in males, and metastatic breast cancer. So there's a lot of treatments and therapies for breast cancer, but we're going to start off with radiotherapy. So according to the faculty in Brazil, UNICA, in 2016, radiotherapy is a painless therapy where it separates the DNA from the cell, not causing it to multiply. So it affects the normal tissues and organs of your body. So since that, just imagine coming out of radiotherapy and you're feeling dizzy and nauseous, but that's the side effects of radiotherapy. Some other side effects of radiotherapy is hair loss, loss of self-esteem, pain, and anxiety. There's 2 ways of having radiotherapy, teletherapy and brachytherapy. Teletherapy is the inner side, the outer side of you. And then there's brachy, which is inner. Then, according to Olivia Pert in 2017, chemotherapy, which is another therapy they uses drugs to treat cancer. And the cycle for this is treatment, recovery, treatment. So this is why a lot of patients are drained out by chemotherapy, because it's one after the other. So chemotherapy side effects have 2 kinds of side effects, physical and the blood. The physical one is mouth sores, hair loss, and birth defects. Side effects for the blood is they lose a lot of white blood cells. And when you lose white blood cells, you get a higher risk of infections and higher risk of blood clogs. There's other types of breast cancer therapies. There's molecular therapy, which is the earliest therapy. There's surgery therapy, which most of y'all know is to remove the tumor. Then there's hormonal therapy, which is to slow or stop the hormonal sensitive tumor. So do you only think women get breast cancer? Well, no. Males and women that are pregnant also get breast cancer. According to Deborah Wise and Deborah Weatherspoon, milk clogs up in your breast when you are pregnant. Because when you are pregnant, your breasts start to change. So a lot of new parents are worried about this because they think it's breast cancer or they think it's something else. So it really worries them. And the treatments are normally discussed with the parents. And so if they don't think a treatment is right for them and their baby, then they won't do it. So chemotherapy affects their baby, so most people don't like chemotherapy. So now let's talk about males. Males have similar effects like we do. There's postal risk factors, metastatic breast cancer, and they have a negative motive of themselves as we do. So when they have hair loss, it also low self-esteem for us. And this is by Sadubin, Sadis, and Marita Fazil Iris in 2016. So the same people also are, according to 67 years of men, are the average age of having breast cancer. That's 5 times higher than the actual women. And the risk factors for having breast cancer in males is because they're around electromagnetic fields. And then the beneficial therapy for males is endocrine, and that's the most beneficial one for males. So males can also have metastatic breast cancer. Metastatic breast cancer is when breast cancer spreads throughout the body, throughout the brain, the liver, and the bones. And this is according to Sabine Sadils and Maritza Ariz in 2016. Pain management, according to Olivia Pert in 2017, is tumor pressed up against the bone and the nerves. Some side effects are fertility, swelling of the site, hair, loss of appetite. Even though that there's no cure for breast cancer, there's treatments that determine the type of tumor it is and the stage that you're on. So Fatise Williams and Stephen C. Satir talked with 5 women about their experience with breast cancer. Their body changes really discouraged them, but they had a brighter field on everything. And the women had brighter days to go through, and they try to get their minds off of it by journaling and having fun activities. So how to tell if you have breast cancer and how other people tell. According to Deborah Wise and Deborah Weatherspoon, they tell if it was tender, if the skin has changed around the area. Then they describe it if it was soft, firm, hard, and they describe its tenderness through this thing called physical examination. Examining for bruising is the next step. Then it is followed with inspection of the lymph nodes, and if they see if it's enlarging, then they see if they needed mammograms. So treatments and therapies control the cancer, and metastatic breast cancer spreads through everything. So I hope y'all learned treatments and therapies, childbearing in males, and metastatic breast cancer through my speech. And after 17 years ago, my grandma died of breast cancer. And I know that she fought really hard because I see the women fighting today through it. Thank you.